Dr. Caffery here. Today I want to discuss with you fish oil supplementation, but specifically as it relates to rheumatoid arthritis. So this is taken from a study published in 2010 entitled Fish Oil and Rheumatoid Arthritis, Past, Present, and Future. So from the study, meta and mega analysis of randomized controlled trials, that's gold standard research, indicate reduction in tender joint counts and decreased use of non-steroidal anti-inflammatory drugs with fish oil supplementation in long-standing rheumatoid arthritis. The main reason that patients with rheumatoid arthritis seek medical treatment is for alleviation of pain and discomfort. Meta and mega-analysis of 10 double-blind placebo-controlled trials show that fish oil supplying 2.9 to greater than 6 grams of long-chain omega-3 fats daily for 3 months was associated with decreased number of tender joints and duration of morning stiffness in patients in rheumatoid arthritis of 10 to 12 years duration. So I think a key point here is the dosage and the length of time. So at least 2.9 grams of these fatty acids in fish oil for at least 3 months. A number of individuals don't take enough and they don't dose it or they don't supplement it long enough before discontinuing. This is taken from a separate article published in 2000, reiterating some of the previous thoughts. It appears that a minimum daily dose of 3 grams of eicosapentaenoic acid, that's EPA, and docosahexaenoic acid, that's DHA, is necessary to derive the expected benefits. Omega-3 fatty acids have virtually no reported serious toxicity in the dose range used in rheumatoid arthritis and are generally very well tolerated. Back to the original study, the meta-analysis concluded that fish oil had no effect on pain, did not consider the extent of patient-determined non-steroidal anti-inflammatory drug use, can be considered a measure of pain. It's clear that fish oil had a non-steroidal anti-inflammatory drug sparing effect in the 4 trials designed to examine that issue. So the point they're making here is some trials say fish oil didn't help with pain, but what they exclude to look at, or what they neglect to look at, is the use of these non-steroidal anti-inflammatory drugs. If your pain level stays the same, yet you take much less of these drugs, then it has a pain relieving effect. It is well established that fish oil decreases cardiovascular risk due to the protective effects of fish and fish oil on coronary mortality, including sudden cardiac death. The latter is concordant with the anti-arrhythmic effects of omega-3 fatty acids, including fish oil. So protective for your heart, which is important because with inflammatory diseases like rheumatoid arthritis, you carry some increased cardiovascular risk. So this is referencing a study where fish oil was actually compared to a biologic medication, which are commonly used with autoimmune diseases. This was comparing it to adalimumab, which is the brand name Humira, and you can see that fish oil actually reduced the pain just as much as the medication did. It didn't do as well, it didn't perform as well when it comes to tender or swollen joints, but as far as pain reduction, it did very well. So overall, meta-analysis provide high level of evidence for symptomatic benefits of fish oil and rheumatoid arthritis. In addition, there is biological plausibility for the effects of fish oil. We know how it works. However, the uptake of fish oil in clinical management of RA is limited. So in spite of the high level of evidence, in spite of it being protective for the cardiovascular system, it's not being used that much. And some of this is due to perception. Some of this is due to lack of knowledge, which is what they elaborate on next. It is probable that the main barrier to clinician acceptance is the promotion of pharmaceutical use as the dominant treatment modality by the pharmaceutical industry sales force that attends to the detailing of doctors. So I think there's some truth in that statement. The pharmaceutical drug model has cultural authority in this country, and there is lack of awareness of other modalities like fish oil supplementation. In the absence of an equivalent marketing effort for fish oil, rheumatologists are not inclined to consider or even be aware of fish oil as a potential component of routine therapy for rheumatoid arthritis patients. Despite the efficacy for symptom relief, the NSAID sparing effect, and the benefits for cardiovascular health, which is compromised in rheumatoid arthritis patients due to their disease. So in summary, fish oil supplementation should definitely be considered with individuals with rheumatoid arthritis and other inflammatory disorders for that matter, as it is an essential fat and most people are deficient in this anti-inflammatory fat. I'm Dr. Caffery. Thank you for listening.